spinal cord injury is a devastating disease that impacts patients, but also their family members, their broader communities. I'm Dr. Biden. I'm a neurosurgeon at Mayo Clinic in Rochester, Minnesota. I'm going to be speaking to you today about a new study that is being published in Mayo Clinic Proceedings. This study is about the use of mesenchymal stem cells for the treatment of spinal cord injury. This is a disease that's been a subject of significant studies around best possible treatments. Mesenchymal stem cells are derived from the patients themselves through a fat harvest, are then cultured and expanded in our impact laboratory, and are then re-injected into the patient through a lumbar puncture. These are patients who have suffered spinal cord injuries. Patients are enrolled within 1 year from the time of their injury. In this case, this is a case report on a patient who had a catastrophic high cervical spinal cord injury, who underwent stem cell injection and then had significant recovery after implantation of the stem cells. It's important to note that this patient was a super responder, and much like in cancer trials, we believe that there will be responders, non-responders, and super responders. This particular patient, who was subject 1 in our study, was a super responder. That's not to say that every patient will respond in the same way. In fact, we know from the study that there are at least 2 of the 10 patients that we have injected are non-responders, and we know that the majority of the others are moderate responders. This is a case report that is important to the scientific community because it does demonstrate that we have the ability through stem cell therapy or regenerative therapies to impact patients' healing after a spinal cord injury. For patients, I think it's important to note that not all patients will recover in the same way, and that although our hope is that these findings will result in novel therapeutic treatments down the road, these interventions are still under investigation through our clinical trials. Our patient in this case had significant improvements in motor function, in walking ability, in sensory function. We've had other patients who we will be describing in future manuscripts who've had responses in bowel and bladder function. This particular patient also had improvement in upper and lower extremity function. I think it's safe to say that regenerative therapies will be a part of future treatment algorithms for patients with spinal cord injury over the coming 5 to 10 years. The exact way in which regenerative therapies will be included will depend on the results of studies such as this one.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.